Hi, and welcome to Jen and Dan's Natural Healing with Plants, the go-to podcast for holistic health seekers looking to harness the power of nature for health and healing. I'm Jen, a passionate health educator, whole food plant-based culinary coach, and master herbalist, and I'm here with Dan, an exercise specialist and wonderful master herbalist. Together, we dive into the world of natural healing, bringing in a wealth of knowledge and practical advice. We draw from both traditional wisdom and modern science with herbs and foods to help you achieve optimal health. Yes, so today we are talking about teeth. And the reason why we're talking about teeth is I, on Christmas Eve, woke up having tooth pain, and I couldn't tell, is it a tooth or am I grinding my teeth? I have a history of grinding my teeth, but normally I grind my teeth on the left side, but this time it was on the right side. And backstory, 2 years ago, I cracked a tooth. I was eating, can't remember what I was eating. I don't remember if it was a peach and it was a peach pit or a cherry. It might have been a cherry in a cherry pit. Anyway, I bit down on it. It cracked a tooth. I went to the dentist and they put a filling on it. And that filling the next day or 2 days later popped up when I was eating and I bit it and I cracked another tooth. And so it was 2 years ago. And I haven't had any problems since then, but that's kind of where the pain has been. And I went to the dentist and I've been studying about teeth and the whole body and everything and the meridians and all of that. And so I know there's a reason why I grind my teeth. Was I grinding my teeth? Is it the tooth pain? What's going on? And the dentist said, when you have infections, it's so connected to heart health that they want to go ahead and give you an antibiotic. And so he gave me an antibiotic right away. They did x-rays, didn't see any signs of infection, but he went ahead and gave me the antibiotic. And so then I was like, oh, I've heard about people having sudden heart attacks when they have an infection in their tooth. Do I take the antibiotic? Do I not take the antibiotic? Do I do my own natural remedies? What's the right thing to do? And so I contacted Dan and was like, what is your advice? I contacted Dr. Rita Marie, who I also work for, and I learned from her through her school, nutritional endocrinology, and got their opinions. So I want a disclaimer before we dig in. We're not telling anyone, don't listen to your doctor, don't listen to your dentist, don't take antibiotics. We're just telling you our own experiences. We're giving you our own information from our own backgrounds. Always do your own due diligence. Anything else I need to say about that? Dan, I just want to dig in. When we are talking about teeth, how do we take care of our teeth? What body systems does it affect? And let's dig in.
Well, the interesting thing about teeth is they're linked to meridians, Chinese traditional medicine. Each tooth is connected to a specific organ. So, for example, issues with certain teeth might indicate underlying problems with your heart, your liver, your kidneys. It's
Yeah.
that chart is very, very interesting if you look it up. Every
Yeah.
tooth is linked to certain organs. So,
Yes, and I don't know, I don't understand how to count the teeth. And so
yeah,
I looked at the meridian chart, and so I was like, is it the kidneys? Is it the large intestine? Like I couldn't figure out exactly which tooth. I
yeah.
also was born without any what is it that people have removed?
Oh,
Wisdom
wisdom
teeth.
teeth. Mhm.
Yes. I don't have any
Lucky.
wisdom teeth. Yeah, and so one of my children, they don't have wisdom teeth either, but the other one does, and so it's strange. I guess I'm evolved. People are having them removed, right?
Yeah.
Anyway, so I didn't know which meridian, and I've been studying meridians, which is interesting because I've been studying them for a while, just dabbling, but I've really been studying it. I think it's Donna Eden, her book, since early summer. I've been reading her book and studying the meridians and following the meridians and then doing Qigong, where we also
Yeah.
talk about meridians and body systems. And so it's funny that I've been working on that too, and how it's all connected because Rita Marie, she's had a lot of speakers recently too, talking about infections in the tooth and how they can lead to heart disease. And so it's funny how everything kind of comes together, right? Everything's related. Nothing is singled out.
Yeah.
Yeah.
Well, they say the bacteria that causes gum disease can cause inflammation, but it can also get into the bloodstream. It causes inflammation in the arterial system. And I don't know, I don't know if it happens to healthy people. Maybe you have to have some immune problems for that to happen, but it can happen. You know, they talk about root canals causing the same problem because the root canals they have bacteria in them. Even if they clean it, I hear that sometimes some of the bacteria lingers in the root canal.
Hmm.
It must not be that well. I know people with root canals are okay, but for certain people, it can cause problems. And
Right.
I don't know if they understand why it causes problems for some people and some people it doesn't. I don't know, but
Yeah. Yeah. It's interesting. So we need to get to the root. We need to find out why do you need the root canal to begin with? You know, where is this bacteria coming from or this infection? Now, for me, I was suspecting it was from that crack. You know, something just
hmm
got into that crack. And then they did say, because I grind my teeth like crazy. I have to get, why am I grinding in my teeth, right? I wake up thinking, oh my God, are my teeth gonna just crumble and fall apart? But I have a crack down the back of the very back tooth that goes down under the gum line. And so,
mm.
you know, how do you know that there's not something going on down there? So one of the things that I have been trying, not only have I added a bunch of herbs in my routine, and we'll talk about those in a minute. Several people recommended to me that I get an ozonator and use
hmm
ozonated water in my water pick. And so you can buy, I can't think of what it's called, but you can buy a system that ozonates it anyway. So I use a water pick and I just ozonate the water and then put it in there and clean my teeth that way. And so that's one of the things that I've been doing. I've been using a water pick for a couple of years. One of my kids, the dentist said, you know, really need to get a water pick or something to help cleaning the teeth. And I really like how that feels. Some other things that I had already been doing or things like using a tongue cleaner, you know, stuff like that. And I have been doing oil pulling for a while too. And so I felt like I was already doing all of these things. I really, really think that mine is just teeth grinding, not an infection. I don't have any fever, don't have any other symptoms, you know, nothing else going on. And like I said, the x-rays didn't show any sign of infection. Now they didn't do the higher end x-rays. I understand there are some that are more kind of like a CT scan that actually can see a little bit more, and they didn't do that. Maybe I should have had that done. I've also heard, and we haven't talked about it yet, you know, we hear about the microbiome in our gut. We have a microbiome on our skin. We also have an oral microbiome. We have a microbiome in our mouth, in our nose. And so, you know, things like that too. And so we have to keep that in balance as well. And I can't remember where I was going uh, with that, but I was also focusing on things in the oil pulling. I have probiotics in there. And so, you know, I felt like I was doing all the right things. I feel like I'm doing the right things for that. So let's talk about some other things that we can do to take care of teeth.
Well, of course, we all know we need a floss and we need a brush. But there's some products that I found recently that I think have helped me because 6 months ago, I had two small cavities. And the dentist I go to, I think he's pretty close to you. He's in Atworth, Georgia. He's a biological dentist, which is more natural. And he saw these two small cavities and he said, we'll just watch them, see if they'll heal. And who says that unless he's a natural dentist? He's right up our alley. So
Exactly.
he sent me
Yes.
home with this toothpaste. It's called Dr. Jen's. It's got that calcium. I can't think. It's called hydroxy something. I don't. Was it?
Okay.
So I used this toothpaste. I used Dr. Jen's toothpaste. Also found a website called calciuminstitute.com. And there's a solution I bought. It has calcium and zinc in it. So I brush with this calcium and zinc and with the Dr. Jen's toothpaste. And
Mhm.
so I started doing that. I was taking some herbs that we'll talk about in a minute. But when I went back for my latest checkup, those cavities had sealed up.
Yeah.
So
That's awesome.
yeah. So it's possible to
Hmm.
heal cavities. I mean, it's kind of random for some people, but it can happen. But I used to have, thinking about, I used to have a cavity that was open for probably 3 years, but it never
Oh.
got infected because I guess because the way I eat, I don't know. But
Hmm.
so yes, these are new products I'll talk about that I've used and they've really helped me. And of course, we're going to talk about some herbs that help strengthen the teeth because you have to do internally and brush your teeth. So you have to eat things that your teeth have to use to keep themselves, they have to rebuild all the time. You know what I mean?
Yes. Yes. Just like our bones. Bones
Mm-hmm.
rebuild and teeth do too. Yeah. We want to
Yeah.
protect those teeth. Yeah. So let's get into it. And so one of the herbs that I've been using that it's funny, I'm going to the herbs that I use for bones, teeth, and hair. They use pretty much the same substances. But my first one is horsetail. Horsetail is very high in silica, and it's just wonderful for the bones and the teeth. But is when that I learned from Dr. Rita Marie. I had no idea that you can't just use the dried horsetail. Like you couldn't just use horsetail powder. It needs to be tinctured. You need to use it as a tea or some sort of extract to get those medicinals out. And so I put that in my tea. I just switched. I'm always double fisting. So I just switched from my tea, which has horsetail in it. It has actually most of these. I might have all of these herbs in it for teeth strengthening. So I just put it in my tea, and it has really doesn't have much flavor at all. Yeah. Do you use horsetail much?
Well, I use the formula, the calcium formula. I don't make a lot of tea, but I didn't know that fact
Uh,
until just then.
uh,
So I'm gonna start doing that because there is a tea I have here that has horsetail in it. So I also have horsetail, just as the single herb. So yeah,
yeah, mine's just a dried herb, so I just added it to my
yeah.
my tea balm. Yes. And so then another one that I like, which is very controversial. As a matter of fact, I heard not Doctor, I heard Rosemary Gladstar talking about this next one yesterday, and it's so controversial, is comfrey. So I love comfrey. It grows in my yard. We have a farm, and comfrey is wonderful for um helping the earth, rebuilding the earth. It's also wonderful for rebuilding our bones and our teeth. I really do like comfrey a lot, but it is one of those that is just very, very controversial. And so don't take it internally unless you are comfortable taking it, that you've done your own due diligence. Is used externally in several different formulas, but people are afraid to take it internally. Rosemary Gladstar said that she takes it internally. And I do have it in my tea because it's a great source of calcium as well.
Mhm.
As a matter of fact, on whatever I listened to yesterday, Rosemary Gladstar said it's one of the most easily absorbable forms of calcium. And so I really do like comfrey. Dr. Christopher's formulas used to contain comfrey until he was told he could not include them in his internal formulas anymore. So some of his products now use lungwort, which I'm really not familiar with, but it's supposed to have the same properties.
Yeah. It does work because when I was healing the cavities I just talked about, I
Mm,
was using his complete bone tissue formula and his herbal calcium. I was taking that 3 times a day, both of them. And I know
yeah,
they had a lot to do with that tooth healing because that's what they do.
right, right, and strengthening.
Mm-hmm.
Yes. Well, the next one is one of my favorites. As a matter of fact, I wrote my thesis on nettles.
Mm-hmm.
So I love nettles, very, very high in minerals, including calcium. It's wonderful for hair, skin, teeth, bones. Yes, nails. I love nettles. It has a very mild flavor. It pairs really well with peppermint, but it's easily added to other teas. And it's one of those that is safe for everybody. So we're comfrey. I'm like, study, decide if it's right for you. Nettles is one of those that I am confident that we can put in our teas.
Yeah, it's like a multivitamin. That was so
Yeah,
full of minerals, you know.
yeah, yeah. I think it was one of the highest vegetables, herbs that we can get. Our minerals. Yeah, I love nettles. And then oat straw. So oat straw is another one that is wonderful for bone strengthening and nails and teeth.
Yes, those 4 or 5 herbs taken together are great for the bones, the ligaments, the teeth, the hair. So I take them on a regular basis because the way I see it, as we get older, things start to break down. So why not give your body nutrition so that doesn't happen? So, the older we
Yes.
get, the better we need to take care of ourselves. I'm a firm believer of that.
Yes. Yes. and especially want to stay younger. So
Oh yeah.
another oil or herb I like to use or spice is clove. I love
Hmm.
clove. Clove is wonderful for the mouth. It's very antimicrobial and also helpful for tooth pain. And I had learned a lot about clove from Dr. Joe. He's a chiropractor here in Atlanta that was really big on YouTube. I don't know if he still is, but he always said that he would keep cloves, the spices, they're pointy. People would put them in their ham or in oranges at Christmas time. They smell really good. But he would tuck one into his cheek if he didn't have time to go brush his teeth, and it would freshen his breath. And then when he just got tired of having his mouth, he would just, throw it in the garbage can. But he could still see patients, and patients didn't know he had something in his mouth, but it was helping to clean his mouth with the clove. I like that, and it is one. Now for me, remember, we're all unique. And so an herb that works good for one person may not work for another. For me, clove is very, very drying. Very, very drying. It dries out my mouth. It dries out my skin. I've tried the oil. I've tried the cloves. I did a parasite cleanse once that had a lot of clove, and my eyeballs, everything was just too dry. When my tooth was hurting, I put one drop of clove essential oil on my tooth, and my whole mouth just dried up. We don't want our mouth to be dry because when our mouth is really dry, things aren't lubricated, and then that's when bacteria can grow as well. And so we want to be careful and make sure that our mouth stays nice and lubricated. So for me, clove isn't the best option, but for a lot of people, clove is a really great one.
Yes, another one is neem. That's used a lot in the Ayurvedic medicine,
Mhm.
but that's another herb that helps protect the oral health. It combats bacteria and prevents plaque buildup, which is really hard to, plaque is always a problem. So neem's something that might help there.
Yes, that's for me, that one's a weird one because we use it on the farm kind of as an insecticide. And so it's
Yeah,
like,
yeah, yeah.
interesting. Yeah. Yeah. So neem. And then myrrh. Myrrh is
Hmm.
wonderful. I always think of myrrh as a pain reliever. It's very anti-inflammatory, but also promotes healing of the gums. And so myrrh is another one. You could get a tincture, and dilute it in water. I've used the essential oil, but I've never put it in my mouth. And so I don't know. Now, Dr. Michael Greger, we both love Dr. Michael Greger, nutritionfacts.org, if you don't know who he is. He recommends that you use green tea as a mouthwash. He says that your green tea is just wonderful for balancing the microbiome of your oral microbiome. It has such wonderful antimicrobial properties that helps keep those bad bacteria in check. And I think that before we logged on, you said something about mouthwash.
Yeah. Uh, a lot of heart doctors say not to use mouthwash because it kills the gut microbiome. So, like,
Yeah,
we
yeah,
could talk about that all day long, but you want to make sure your gut bacteria is healthy because it dictates how healthy your whole body is. So, anything
right.
that we can do to destroy that, we don't want to do.
Yeah, you think about when you open it or smell it, you can smell all that alcohol. And we know
Mm-hmm.
alcohol is not right for our body. The
Mm-mm.
alcohol, is drying. It's going to be wiping everything out of your mouth. And we need to balance the bacteria. We need those good bacteria to flourish in the mouth to help keep everything else in check. So let's talk about foods. What foods are helpful? So we talked about herbs that are helpful. What foods are helpful for keeping the oral microbiome in health and keeping the teeth strong and healthy?
Definitely, you gotta look at your leafy greens. Leafy greens are really high in minerals and calcium.
Yes.
Celery and carrots, they're really good.
I think of apples too. Apples, when
Oh
you're
yeah.
you're chewing on these,
Mm-hmm.
even though they have some sugar in them, natural sugars, when you're chewing on those, just that chewing helps to clean off the teeth. Also the brightly colored foods, the foods that are so high in antioxidants, those are wonderful. We want to make sure we're eliminating things like the alcohol that we talked about, sugars, flours, even dried fruits, and anything that's going to like stick to the teeth. Those things, they're just gonna if it sticks to your teeth, then so is other bacterias and things like that. They're not going to be coming off of the teeth, and that can lead to problems. And so that goes back to our oral hygiene, flossing and brushing, using water picks and things like that. And then also adding in probiotics. So not just like taking capsules, but eating non-dairy yogurt. I make my own non-dairy yogurt, super simple to make. You can have coconut yogurt or almond yogurt. I make mine with walnuts and hemp seeds, but all you do is you blend it up with some water in your blender, add some probiotics, empty a couple of capsules, and then set it in a dehydrator or a yogurt maker, something that's going to keep it at a constant temperature for 24 hours. And then you have this wonderful yogurt. So things like that are wonderful. Sauerkraut is another thing that's super easy to make with those natural probiotics that are just so wonderful in your mouth as well as your entire system. We need a good healthy system because everything is connected, like we said before.
Yeah, it's also like kimchi.
Yes, I do too. I love kimchi.
Yeah.
Yeah. So what have we left out?
Um, Meridian healing, I guess it talks about if you're having problems, like, I mean, I guess well-informed dentists might know this, but if you're having some kind of health problem in a certain organ, it might be worth getting your teeth checked and
Yeah,
see if the tooth, of course, corresponds with the problem you're having. Could be a problem. It could be an infection in that tooth. See, a lot of people don't think about this, but you need to have your teeth checked if something is going on in your body.
yeah, yeah.
Could be an infection.
Right. And health coaches, doctors, you need to be asking your patients and clients about their dental history. Did
Mm-hmm.
you have a lot of cavities as a child? Do you have fillings in your mouth? Do you have a metal mouth?
Yep.
When you brush and floss, is there blood? Are you spitting blood when you're flossing and brushing? That's a sign of something going on as well, which is also connected to heart conditions. And so we want to make sure that we're paying close attention to that. And if you have a constant something going on in a certain area of your mouth and your teeth, then like he said, it may be connected to one of your meridians, the kidney meridian or the stomach meridian or lungs or large intestines, depending on where in your mouth. There's fabulous charts that you can look at and see where the meridians are connected to your teeth. They're also connected to your fingertips and your feet. I used to go to a fabulous reflexologist, and she would feel your feet, and then she'd say, you have something going on in this area, and be like, oh, I have had pain in that area. She could feel it in your feet, which is fabulous. But that's all connected to the meridians, which are also connected to your teeth. So you have pain in a certain area, it may be related to something else in your body.
Yes. It's an amazing, amazing science.
Yes, think about acupuncture goes
Oh,
along the
yeah.
meridians. Yeah, and so we can't discount it. And then I mentioned oil pulling earlier. For some of you who aren't familiar with oil pulling, be careful with it. Read about it. See if it's right for you. We don't want you to swallow or choke on it, but you just put a little bit of oil, like coconut oil. Some people use sesame oil, and you put it in your mouth, and you just swish your teeth, kind of like you're using a mouthwash. You just swish, 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 swish as long as you can, and then you spit it out in the garbage, not in your sink. We don't want the oils to go down your sink. But it's a great way to clean the teeth without destroying the healthy bacteria. We don't want to kill off those healthy bacteria. Something that I do, like I said, is I make these little caps. I just mix up melted oil with my probiotic capsules and a couple of the essential oils and the herbs that we talked about earlier, and then put them in my freezer. And then I just stick in my mouth and swish, swish, swish as long as I can, and then spit it out to help clean my teeth. Something that we also want to make sure you're not doing is using toothpaste with fluoride in it.
Yeah, I know it's controversial, but I think there's a lot more information coming out now about that. I haven't used fluoride in years. I mean, there's actually
Very
studies
good.
showing that it can actually weaken your teeth if you get
Mhm.
too much fluoride. So the toothpaste I'm using, the Dr. Jen's, it's a form of calcium. I can't think of the name, but I'm convinced with it. I've used all kinds of products over the years,
Mhm.
but I do recommend Dr. Jen's toothpaste. It's on Amazon. I also
Okay.
recommend the Calcium Institute. I recommend them because look, I held a cavity and I know that that has something to do with it. Those things along with the herbs. So,
Mm. Yeah. Yeah, me too. I haven't used any fluoride. I want to say at least since 2013. I quit toothpaste in 2013 and started
yeah.
making my own toothpaste. I do use a toothpaste, but it doesn't have any fluoride. But I also use Dr. Christopher's tooth powder.
Oh,
I put
yeah.
that in my oil pulling stuff as well, and that has wonderful things in it too to help with the teeth. Yeah, so you want to look for a natural toothpaste that doesn't have fluoride that helps to support your microbiome. Flossing, using water picks, those are also wonderful things. Cleaning your teeth, and then finding a holistic dentist or a biologic dentist, like Dan was talking about earlier, is a wonderful way to support healthy teeth and gums. Yes. Do you have anything else you'd like to add about the teeth, Dan?
I just people need to take really good of their teeth. If you're looking to be healthy as possible, do not neglect the teeth. And I think most
Yes.
people know that now, but
Don't push through the pain. Go get it checked
no.
out.
Yes.
Go get it checked out. Yes, and so Dan will give us the name for his toothpaste and his calcium formula. That will be in the show notes, so be sure to check out that. Let us know what you think about this episode. Let us know what you agree with, don't agree with. We'd love to hear from you. And thank you for listening. Subscribe to our channel. And you can find me at holisticgen.com. You can also find Dan at danthenaturalman.com. We both also have YouTube channels, Dan the Natural Man and Holistic Gen. So we hope to see you in those places as well. So until next time, keep healing with plants and take care of your smile.